I'm Panithaya Chareonthaitawee, and I'm a cardiologist at the Mayo Clinic. I'm a professor of medicine, and I actually serve as director of nuclear cardiology and also education chair for the Department of Cardiovascular Medicine. And then I'm also the current president of the American Society of Nuclear Cardiology. So that's a great question. So when I was going through training at Mayo Clinic in Rochester, Minnesota, in my first year of training, we call that internship, I worked with several established nuclear cardiologists, Ray Gibbons, and he introduced me to, I didn't know anything about nuclear cardiology, but he introduced me to nuclear cardiology as a field, as a clinical field, but also as a research area. And there was, when he introduced it to me, there was a lot of potential in terms of not only clinical practice, but also a lot of potential for some very exciting research that involved many aspects of science, but also clinical medicine and imaging. And so I think the combination of all those things really made this very attractive to me. And so then I continued to work with the group, the nuclear cardiology group, in research, and was very drawn towards the field. And then when I decided to do my fellowship, I knew that I wanted to probably pursue nuclear cardiology as a career. And I knew that I wanted to do academic nuclear cardiology and to practice probably in an educational and academic institution and setting. And at the time, we didn't have any PET imaging at all at Mayo Clinic. And this, I'm dating myself a little bit, and so I actually went to Ray Gibbons, who was lab director at the time, and I said, you know, I do know that I want to be practicing nuclear cardiology and be an academic nuclear cardiologist in the future. And where can I get cardiac PET training, because we don't have it here? And his eyes just lit up and he said, funny you should come and ask me right now, because we're going to get PET here at Mayo and a cyclotron in a few years, and I don't really have anyone formally trained in it. And since you've done well, why don't you go and get the training and come back and start the program? And so they sent me away as a Mayo Foundation scholar, sort of a sponsored sabbatical in a way. And I came here to London, to London, England, and to the Hammersmith MRC cyclotron unit, which became part of Imperial College. And I spent a year and a half there studying advanced cardiac PET imaging with Professor Paolo Camici and a whole laboratory. And it was a very exciting time. I learned so much, but I think it really was a huge benefit, not only to Mayo when I returned to start the service and do research, but also just for my career in terms of having this special niche that at the time it was quite early, and not as many cardiologists were trained in in cardiac PET imaging. So it was a very exciting time, and I learned a lot. And it's just been, I've seen sort of the whole kind of cycle, the ups and downs, and now kind of a resurgence in PET imaging, cardiac PET imaging, and this is very exciting right now. Yes. It's been an amazing event. Similar to the American Society of Nuclear Cardiology events, particularly our annual meeting, this is a small to medium-sized meeting, and the opportunity to network has been outstanding. I have met so many individuals like yourself, and it's been just having great conversations about the field of nuclear cardiology, getting to know each other, making connections. And so I think that's been really amazing for me, to get to know more people and to have these potential for collaboration. We signed the agreement with BNMS, and I think that there's been some really great science here in terms of the nuclear cardiology as well as general nuclear medicine, and different perspective than what is happening in the US. So it just helps me to think a little bit differently about infrastructure, cost, implementation, and it's just exciting to kind of think a little bit differently about, oh, you know, if I only had these resources, or if I had these resources, what would I be doing differently? So it's all been very exciting. So many things excite me about the future of nuclear cardiology. We're really seeing a huge resurgence now. You know, there was a time when there was not maybe a lot of new developments, but this is a very exciting time. For over 20 years, we did not have any kind of new FDA-approved perfusion tracer, and just in the last year, we had approval of F-18 flurpiridaz, and this is just an amazing time to be looking at this and thinking about, and we just started our first patient with flurpiridaz, studied the patient on Friday before I came here, and I think this will open up opportunities for access to PET around the world and really help us to deliver patient care and think about coronary artery disease in a different way. So there are many potential opportunities. There are also new tracers being developed, other F-18 perfusion tracers. There's an O-15 delivery system that's being investigated in a phase 3 trial. And there's a lot of work being done on the amyloid front with different tracers to diagnose and to really identify patients who need treatment. So I think it's just a great time to be a nuclear cardiologist or be in the field of nuclear cardiology right now. So I think because of all these developments, there are more people gravitating back towards the field, and there's a lot of discussion, education, and research. So a very exciting time to be in the field. Yes, favorite isotope. This is very difficult because it's like asking which one of your children is your favorite, and so I have several. I think one is it's still FDG, believe it or not. It's like that problem child that gives you challenges and you have to find ways to make it work. And so working with FDG at the myocardial level, at the cardiac level, is very challenging because you have to prep the patient in different ways. And I think because of these challenges and because I've been working with it for a long time and did a little bit more sort of basic science research work on glucose metabolism, it's been a favorite of mine for a long time. But it's an oldie, it's been around forever, but it keeps giving you problems. But I think the other favorite is going to maybe have to be F-18 flurpiridaz, because it's brand new and there's a lot of excitement about it. And we just did our first 2 patients, our clinical patients, and I've been involved with the education, with some of the trials, and so I think it has a lot of potential, but at the same time we need more data, and that means that there's a lot of potential to do research and to see how it will potentially change practice and impact patient care and outcomes. So I think lots of things. I mean, there are lots of other isotopes that we could talk about as well that are, in the realm more of research at the moment, with the amyloid tracers, and also FAPI might be another interesting one. I mean, the list goes on, but if you had to, ask me and pin me down, those would be the 2. Yes. So I work with a lot of trainees, a lot of students and residents and fellows. And after a long training period, I think um, there's maybe a tendency to say, okay, I've been in training for a long time, and I have to stop, right? But I think that extra time that is going to give you additional expertise. I mean, I did this. The year and a half I did at the MRC cyclotron unit, it was really life-changing for me. It wasn't easy, but I think it can really change the trajectory of someone's career. And so I think when you have had such a long journey, another year or year and a half.
Something else?
Yes, I mean, I know that training is long, but I think the additional year can, sometimes people don't want to do that additional year, but it can really change your career.
Yes.
Yes, and then everything is a balance, so you have to see where things are in life, and is it the right time, and the balance of everything together.